Our lungs are constantly working, inhaling and exhaling more than 20,000 times a day, delivering oxygen to every part of our body. Yet, we often take our respiratory health for granted until something goes wrong. From air pollution to infections, respiratory issues can arise from a variety of causes, many of which are preventable. In this video, we'll explore the different causes of respiratory problems, the preventive measures we can take to protect our lungs, and the foods that can either support or hinder our respiratory health. Respiratory problems are diverse, ranging from mild discomfort to life-threatening conditions. The underlying causes can be environmental, lifestyle-related, or even due to infections. One of the most significant contributors to respiratory problems is air pollution. Pollutants like particulate matter, PM 2.5, ozone, nitrogen dioxide, and sulfur dioxide, commonly found in vehicle emissions, industrial smoke, and construction dust, can infiltrate the lungs. Prolonged exposure to these pollutants increases the risk of asthma, chronic obstructive pulmonary disease, COPD, and even lung cancer. Pollutants can irritate the airways, causing inflammation, and over time, this damage can be irreversible. Children, the elderly, and people living in urban areas are particularly vulnerable to the effects of polluted air. Allergens such as pollen, dust mites, mold, and pet dander can trigger allergic rhinitis or asthma, leading to symptoms like sneezing, coughing, wheezing, and shortness of breath. For people with respiratory sensitivities, even minor exposure can provoke an intense immune response, causing airway constriction and inflammation. Repeated exposure to allergens can lead to sinusitis and bronchial asthma, which is characterized by inflammation of the bronchial tubes. This can result in difficulty breathing, chest tightness, and persistent coughing. Viral and bacterial infections such as the flu, common cold, bronchitis, and pneumonia can significantly impact respiratory health. These infections often start in the upper respiratory tract, nose and throat, but can quickly move into the lungs, causing swelling and mucus production, which blocks airflow. Pneumonia, in particular, is a severe infection where the air sacs in the lungs fill with fluid or pus, making breathing incredibly difficult. Exposure to cold, dry air can be harsh on the lungs. For individuals with pre-existing conditions such as asthma or COPD, cold air can cause the airways to constrict, leading to shortness of breath and coughing. During the winter months, the risk of respiratory infections increases. Cold air can reduce the efficiency of the immune system in the respiratory tract, making the body more susceptible to infections like the flu and bronchitis. Individuals with weakened immune systems, such as the elderly, young children, or those with chronic diseases, are more prone to respiratory infections. Their bodies may not be able to fight off common viruses and bacteria, leading to conditions like laryngitis, tonsillitis, and lower respiratory tract infections. In these individuals, even a mild infection can lead to more severe complications like pneumonia or bronchitis, which may require hospitalization. Given the wide range of causes, protecting your respiratory health requires a multifaceted approach. From environmental control to lifestyle changes, there are many steps you can take to keep your lungs healthy. Regular hand washing is a simple but effective way to reduce the risk of viral and bacterial infections that can compromise the respiratory system. Avoid touching your face, especially the mouth, nose, and eyes, as this is a common way for infections to enter the body. Keep your home clean by dusting regularly and vacuuming with a HEPA filter vacuum. Use air purifiers to reduce the amount of allergens like dust and pet dander in the air. If you have a known allergy to pollen, limit outdoor activities during high pollen seasons and consider wearing a mask when necessary. Smoking is one of the leading causes of preventable respiratory diseases like COPD and lung cancer. If you smoke, seek support to quit. Even if you don't smoke, exposure to secondhand smoke can be equally damaging to your lungs. It's important to avoid environments where you might inhale harmful smoke. On days with high pollution levels, try to stay indoors, especially if you live in an urban area. Use apps or websites that monitor air quality to stay informed. If you must go out, wear a mask designed to filter pollutants. Vaccines are a powerful tool in preventing respiratory infections. The flu vaccine, for instance, can significantly reduce your chances of getting the flu, which can lead to severe complications like pneumonia. If you're over 65 or have chronic conditions, a pneumonia vaccine may also be recommended. Dry air, especially in the winter, can irritate the respiratory tract. Using a humidifier adds moisture to the air, making it easier to breathe and reducing the risk of infections. What we eat can have a profound impact on our respiratory system. Certain foods can help protect and heal the lungs, while others may contribute to inflammation and worsen symptoms. Known for its potent anti-inflammatory and antibacterial properties, garlic contains a compound called allicin, which helps fight off infections and reduces inflammation in the lungs. Incorporating garlic into your diet can help boost your immune system and improve respiratory function. Ginger has long been used as a natural remedy for respiratory conditions. Its anti-inflammatory properties help relax the airways and reduce inflammation. It's particularly beneficial for those suffering from asthma, colds, or bronchitis. Honey has soothing properties that help calm irritated airways and reduce coughing. It also has antibacterial and antioxidant properties, making it an excellent remedy for respiratory infections. Citrus fruits like oranges, lemons, and grapefruits are packed with vitamin C, a powerful antioxidant that strengthens the immune system and helps protect the lungs from infections. Vitamin C also helps reduce inflammation and may protect against conditions like COPD. The active compound in turmeric, curcumin, has powerful anti-inflammatory effects that can help protect the lungs from damage. Studies have shown that turmeric may help alleviate symptoms of chronic respiratory conditions and improve overall lung function. While certain foods support lung health, others can have the opposite effect by increasing inflammation or causing mucus buildup. High in unhealthy fats, fried foods can increase inflammation in the body and hinder lung function. They can also contribute to weight gain, which can put additional pressure on the respiratory system. Sugar suppresses the immune system, making the body more vulnerable to infections. It can also trigger inflammation, which exacerbates symptoms in individuals with asthma or other chronic lung conditions. Alcohol consumption can lead to dehydration, which thickens mucus in the lungs and makes it harder to breathe. It also weakens the immune system, making it harder for the body to fight off respiratory infections. Processed foods often contain preservatives and chemicals that can irritate the lungs and trigger allergic reactions. These foods are also typically high in sodium, which can cause fluid retention and worsen conditions like COPD. While not everyone is affected, some people find that dairy products, such as milk and cheese, can increase mucus production in the respiratory tract, making it more difficult to breathe. Breathing is a vital process that we often take for granted until something goes wrong. By understanding the causes of respiratory issues and taking proactive steps to prevent them, we can protect our lungs and enhance our overall quality of life. Incorporating lung-friendly foods into your diet, avoiding harmful substances, and maintaining good hygiene are key to maintaining strong, healthy lungs. Remember, your respiratory health is in your hands. Start taking care of it today. Thank you so much for watching. If you enjoyed this video, don't forget to give it a thumbs up and subscribe to the channel for more content like this. Until then, take care and see you in the next video.